20%. This translates to 1 out of 5 people in the U.S. that have been diagnosed with a mental illness. Although, not all the people that suffer from a mental illness seek help. This may be because they have a barrier up, pride, they may be scared, or maybe they don't have the resources to be able to get this. Some people don't realize how important their mental health can be. Your mental health determines whether you want to push yourself to be better or sit there and do nothing. Also, your mental health is just as important as your physical health. They balance each other out. For example, say you want to play a school sport. Well, you have to have the right drive, the right mindset to be able to actually do it correctly. Today, I'll be talking about depression. First, we are going to start by entering the playground of depression. We will be climbing up the ladder of symptoms, then down the slide of causes, and then swinging on the swings of treatments. First, the symptoms. These symptoms break down into 5 different categories: mood, sleep, whole body, behavioral, and cognitive. The most common thing that comes out of these things is thoughts of death or suicide. Most people start to feel unworthy of their life. People will start to feel guilty for no reason. Loss of sleep may become a habit, or even oversleeping. Some people may even start a habit of overeating or not wanting to eat at all. Either one of these may cause a person to have less energy, overall less drive. They will have trouble making decisions for themselves. People will lose interest in everyday activities they used to enjoy, such as being with family and friends, going for a bike ride outside. Like I said, again, this ties all back into the physical and the mental health. For someone to be considered to have depression, they must be feeling the symptoms for at least 2 weeks. When a person has depression, they can also have symptoms that are called psychosis symptoms. This is when a person starts to have hallucinations or delusions. This is just basically when a person thinks they see somebody or they think they hear something. Bipolar disorder also falls into the depression category. This is a manic type of depression. This just means you may or may not be able to control your emotions. It's as if your emotions change at the flip of a switch. When people already have an illness and they also suffer from depression, it can take an even deeper toll on the illness that they have. Symptoms also may vary for different ages of people who suffer from it, such as young kids throwing tantrums all the time, not wanting to go to school, or compared to elderlies that may already have an existing illness, and then depression takes an even deeper toll on them and makes it much, much worse. Statistics show that more women have been diagnosed with depression than men. But this doesn't mean that men don't have it as often as women. Men just may not seek help, may not want to admit it, to confront it. They put up that pride, that barrier, or they may not even know that they have it. Also, symptoms aren't just mental. There's physical ones too, such as having stomach problems or headaches. Now, let's get into the causes. The first one is childhood trauma or past experiences. This is really important because your past experiences determine how you view the world now. Another one is your physical health. Like I said, both of these already go off of each other, so if your physical health isn't good, then your mental health won't be good either. The next one is drugs and alcohol. These have a very big impact on this because let's say you're trying to stop doing drugs and alcohol, but you go into a state of depression. Or you get depression and you start taking drugs and alcohol. The next thing is depression may just run in your family. It may be genetic, which isn't the best thing, but it can happen. And the last one is grief. Grief can impact many things in your life. It is when you lose a loved one or somebody really close to you. You may not have a sense of direction, a guide, but grief doesn't always make you go into a state of depression. All of these tie together because say you had a bad childhood, then when you go into your adult life, you start using drugs and alcohol. So all of these things tie into each other. Or like your physical health. You may not want to, do you have grief and you usually play a sport, you go for a run every morning or something, the grief may take a toll or you don't want to do that anymore. Now, let's get into the swing of depression, of the treatments. The first one is therapy. Therapy is a great way to treat depression because it is a place where you can go and just express your feelings and not be judged at all. The next ones are medications. There are 4 different types of medications that you can take for depression. The first one is SSRIs, which are made to just ease your symptoms. The second one are antidepressants, which are supposed to relieve your anxiety. The next one is anxiolytic. These are used to relieve your anxiety and your tension, and sometimes they may help you sleep better. The next one is antipsychotic. These are used to reduce the symptoms of this psychiatric. The last one is a medical procedure called electroconvulsive therapy. This is a shock wave or electric current that goes up to your brain. These electric currents tell your nerves what they should be doing. Instead of thinking badly or sad, they tell you to think more in a positive way, a better way. In conclusion, depression takes a toll on many, many things in your life. Like first, the ladder of symptoms, you have physical symptoms, mental symptoms, you have the bipolar disorder, psychiatric symptoms, and then when you go on the slide of causes, there is grief, drugs and alcohol, childhood trauma, or past experiences. And then when you wrap up on the swings, there are therapy, medications, and electroconvulsive therapy. And all of these things tie in together because one thing, it's like a domino effect. If one thing goes off hands, then everything else does. So, and remember that your mental health is just as important as your physical health. And also going back to the symptoms, mood, sleep, whole body, behavioral, cognitive. Let's say your whole body isn't doing good, then your mood probably isn't going to do good. Or your sleep isn't going to do good. Like I said, domino effect. Thank you so much.